Shall we start, Fabrizio?
Yes.
So, good afternoon to all. Thank you for being here. We hope for more participants, but in fact, it's like an initial presentation of the registry, and I would say like a presentation for discussion and an official announcement of the registry. There will be another presentation maybe on next September. So the liver surgery registry, and we call it LIVES registry. It's a registry for all the liver surgeries or interventions for whatever the kind of pathology is there. The idea comes, in fact, from the fact that we have limited number of cases in Oman, and even I would say in the region. Each center has a limited number of cases. For example, if we take the statistics from Oman, which was released in 2018, which is the last one, regarding the cancer incidence in Oman. I will speak here about the colorectal case and liver and gallbladder cases. The colorectal cases, we have around 100 in males and 100 in females, so 200 in total, and around I would say 60 cases in males for the liver and gallbladder cases, and 30 cases in female. And of course, I would say majority of them, they are not surgical candidates. So we can imagine the number of surgical cases in colorectal pathology and liver and gallbladder pathologies. Of course, the numbers could be higher than what's recorded or announced, but still we don't have enough numbers. The colorectal cancer is the most or the top on the list in case of male patients, and it comes as the third most common cancer in case of females. Also, the number of or the incidence is similar, is around 100 for both gender. And if we take, for example, the colorectal cancer, which is stage 4, which that's the stage that have, I would say, or could have liver disease, it's around 20% of all cases. So if we talk the whole number, which is 200, we have around 40 patients with the stage 4 colorectal disease. And of course, I would say maybe majority of them, they are not surgical candidates. And in case of liver cancer and gallbladder cancer, the most common, of course, is the hepatocellular carcinoma, which accounts for around 80%. So the objective of the registry is to have, I would say, like a well-organized documentation, a prospective documentations of all liver surgery cases. It's a sort of multicentric collaboration, which is, I would say, more scientifically more evident or more strong than monocentric publication or data. Of course, the collection of the statistics means and the collection of data means a scientific publication in the future. We have more number, more ideas, and scientific publications will come after that. These publications, of course, will I would say at the end could improve our patient care, could modify our approach for our patients. The logo, which was designed by Omar Al-Busaidi, has three I would say three signs. The glowing lines, which means the sharing of results or the publication of the scientific studies. which will come from our registry. The second item is the liver, which is the subject of the registry. And the third item is the points and crossing lines, which means that the participating centers and the data sharing between these centers. Till today, we have 5 participating centers. We have Sultan Qaboos Comprehensive Cancer Care and Research Center, and we have Sultan Qaboos University Hospital, and we have Armed Forces Hospital from Oman, and we have 2 centers from United Arab Emirates. We have Cleveland Clinic from Abu Dhabi, presented by Dr. Isa, and we have Sheikh Shakhbout Medical City, which is in collaboration with Mayo Clinic in Abu Dhabi as well, presented by Dr. Amal Suhoud. When it comes to the scientific committee or the coordinator and scientific committee of the register, we have 4 members. We have myself as the general coordinator. We have Professor Benaro as scientific coordinator for the registry, and we have Dr. Isa and Dr. Amal Suhoud as members of the scientific committee. Of course, when we talk about the registry, of course, we talk about the data request. We have some rules regarding this section. The request has to be sent to the scientific committee by email, and it has to be submitted, I would say, to the committee by those or by the participants who have at least 20 patients added to the registry. And each application will be evaluated by the scientific committee, and usually a reply will be sent to the applicants within, I would say, around 3 to 4 weeks. And each application's principal investigator must sign a document pledging a sole dedication to the approved research question after receiving a permission for the study. And in regard to the publication policy, prior to submission, each article or abstract arising from the registry should be forwarded to the scientific committee. Not really, I would say, to judge the article, but mainly to make sure that the article is as the initial question, which was approved initially. And of course, with that, we could suggest some modifications for the article. The choice of the journal is up to the principal investigator. Regarding the authorship, the first and last position will go to the principal investigator center. Then the next 5 positions goes to the 5 largest contributing centers, and the remaining positions will go to the principal investigator center. So now we'll have, I would say, a short overview about the registry. So the registry, it comes like this one. If we want to add, like, for example, a new patients, it's called add new record. And we have I would say, many items, including patient data, disease history, colectomy or proctectomy data if it is there, hepatectomy data, post-operative data for the first stage, and post-operative blood results for the first stage. And it's there for the second stage if the second stage is planned or done. And at the end, we have the follow-up. If we take, for example, the patient data, automatically there will be a project ID, which is specific for this record or for this patients. We don't puts like details or file number or patient's name, just to avoid any disclosure of patient's privacy. So I would advise each participants to keep a record of their patients with the project ID. Of course, the participation has to be agreed by the patients, and the consent has to be taken. We have a consent form which will be forwarded to each participant. Then we have the centers, the participating centers, the gender, birth date, weight, height, body mass index, if there's any comorbidities like diabetes, dyslipidemia, if there's any hepatic disorders, previous hepatic surgeries, child score, mid score, and other score. Once the form is completed, it has to be it has to be green here as a green button. Then the disease history. Always we have the project ID here, the date of the liver lesions diagnosis and the preoperative diagnosis. If we click, for example, on a specific diagnosis, we may have another article which pop up, which we need to fill. Like, for example, this one, regarding the metastasis, if it is synchronous or metachronous. If the other data will be like, for example, neoadjuvant therapy, RAS mutation, RAF mutation, MSI, HER receptors, factor receptors, the preoperative blood results and tumor markers, and the preoperative imaging, and if there is any portal vein or hepatic vein embolization. Then the colectomy data or proctectomy data. For example, if the primary is still in place, no, we have other details that we need to fill, and so on. Regarding the hepatectomy data, we have the dates, title of the intervention, if it is minimally invasive or open surgery, elective or emergency, type of hepatectomy, if it is extended resection and or associated organ resection, and the details of the intra-op, I would say, findings or steps like Bringles maneuver, any vena cava clamping, estimated blood loss, drainage, biliary drainage, the duration of the intervention, and if there is any second stage hepatectomy. The post-operative data includes, for example, the admission to ICU, admissions to high dependency area. If there is complications, for example, if we have like, for example, bile leaks, then we have to specify which grade of bile leak. And then if there is any re-intervention, and the date of drain removal, preoperative blood transfusion, the intra-hospital death, if it is, if any, and date of discharge or intra-hospital death, and then the Cleveland Dindo score scale for the complication or the post-operative events. And then at the end, the histopathology diagnosis. And for example, if we have many lesions or even single lesion, we have to note the size of the largest lesion. And if there is any readmission after or within the first 3 months of discharge. The post-operative blood results, it will come as this one, as this, I would say, table. We have the day 1, day 3, day 5, and we have to fill the hemoglobin, platelets, white cell, neutrophils, lymphocytes, ANR, C-reactive protein, liver enzymes, and bilirubin level and albumin. And it is similar for the post-operative data in case of second stage and post-operative blood results in case of second stage. For the follow-up, we have the section for the adjuvant treatments. If we have, like, for example, chemotherapy, we have other pop-up articles that we need to fill. And in case of death, in the first 3 months, we have to notify that. And then the date of last visits and the disease condition at the last visit. This is in general about the data that we have to fill. Of course, maybe it's sort of comprehensive data or comprehensive details. It may takes time, but we want it to be like sort of I would say complete or comprehensive records, so that it means at the end we have many ideas for work and publication later on. So this is another view, I would say, about our registry. And of course, the open is door for the door. Sorry, is open for any discussions, any suggestions. And thank you for being here today.
Thank you, Abdullah, for this idea. I think is very good for a small country as Oman, because each center has a few cases. So I think it's very good to have a big registry for all patients. I have a question. Could you show if we need to update a patient after 1 or 3 years? I don't know if we have a recurrence rate. If, do you have the possibility to update the patient in the registry?
So yeah, again, Fabrizio, if we have a patient.
Well, yes, if we need to update a condition of a patient
Yes.
insert to the registry. I don't know if we have a recurrence after 5 years.
Yes, it will be filled in the follow-up. I would say data. We can change the date date of last visits. And then we can, I would say, comment if he has recurrence or not. We don't have, for example, more details at this stage, because I would say if we open the door for such, I don't know, this is my opinion, if we open the door for like long time follow-up, it would be sort of complicated, maybe data filling for participants. And I'm not sure if the participants will fill such data at the long term. But I agree, it's a good suggestion, good question. I mean, to look for what will happen for such patients in the long term. But still, we can change the date of last visits and change the disease condition at that time.
Yes. This registry is not only for the malignancy, but also for a benign tumor, no?
Sure, yeah. For all liver surgery, whether it's benign or malignant.
But the patient need to be operated, or if the patient need to undergo surgery to insert the patient in the registry, or every patient that just did radiological procedures.
The patient has to be operated already.
Yes.
For example, like planned patient for surgery, I would say not to be included, but those patients who are already operated. And of course, I would say regarding the follow-up, there will be a reminder for the participants between now and then to update the patient condition.
You decide also if you know if you have a report yearly every year at the end of the year you can send a report of the registry.
Sure.
What
We have like a statistics page in the registry, which show us the data or the number of patients collected and from which center, and we have also what we call it data backup in case of any problems happen. Of course, the registry is online registry, and we know we may have any problems, technical problems or problems related to such thing. So we need to back up our data between now and then.
Yes. And but I think the
Abdullah?
Sorry.
No,
Yes.
sorry. Go ahead, Fabrizio. It's okay.
No, I think the problem is to motivate, is as in France or in Italy, in Europe, or in the United States, is the main problem is to motivate the doctor of each center to insert the data, because it takes time. And sometimes we have a lot of patients, we don't have time to, because I think take 15, 20 minutes to insert the data. So I think this is the main problem of each registry. So did you find a solution to motivate the doctor to insert the data?
I totally agree. It takes time, in fact, to fill the details, and it's not easy. I would say one of the solutions to send a reminder between now and then for data filling and for updates of patients' conditions. The other thing is, for example, if we have the facility of, like, for example, research nurse or residents who could help us in data filling, this is another option. But I totally agree, it's not easy.
Yes, I saw that we need also to involve the Royal Hospital, because actually is I think is the main hospital to do liver surgery in Oman. So we need to discuss with our colleague to try to have the Royal Hospital in this register, because I think it's very important for everybody to know every year how many patients we included, the result, to show to the entire population of the Oman the result of the liver surgery in Oman. So I think it's very important to try to involve the Royal Hospital too. So I think this is the next goal is to discuss with Royal Hospital colleague.
So we have Dr. Luath here today.
Yes. I don't know if we have some surgeon from a Royal Hospital.
We have Dr.
Hello, hi,
Luath.
Fabrice. I'm here around actually. So I joined late because I'm in the OPD. Well, the idea is very good actually. We are familiar to do this registry in Europe. I mean, me and Abdullah, we have the experience in France, either in pancreas or liver registry. Yes, Fabrizio, as you said, we do have a lot of cases here in Royal Hospital. I have discussed with Abdullah regarding the registry. And I think before we did the registry, this idea was there since we came back from France, and it should be a national registry to get the maximum of the cases, and that's why, I mean, this is the aim of the registry. The registry should not be a single or two institutions. Actually, it should be more than one institutions. We are working on that. I told Abdullah, we might not join at the beginning just to sort out some administrative things, which I'm working on. But sooner or later, we are joining this registry, either directly or indirectly, because I think for this registry, Royal Hospital is going to be main input, and for this registry, because we are doing almost 3-4 cases per week of either liver metastasis or cholangiocarcinoma or HCC, and I mean hepatectomy in general, or for benign conditions such as hydatid cyst and other benign conditions. The idea is great. As Abdullah know, I was so supportive for this idea. I introduced it to our colleagues, and you are hearing me, no? I hope.
Yes, yes.
Yeah,
So,
we really appreciate your effort, Alwarth. As Professor Benara said, your participation will be a strong, I don't know, push for the registry. Hopefully, if not direct, I would say indirectly, we'll have the things to be connected. But really, we appreciate your cooperation, Alwarth.
I already submitted the research proposal or registry proposal, because we need to get authorization. I mean, in the oncology center, it's so easier because the authorization part is in the center itself, whereas in the Royal Hospital, the authorization part has to go to the Minister of Health. I think it might take a little bit time, but regardless of this, I have some motivated residents and motivated even medical students actually to collect the data, and let's see how things goes. Retrospectively, I mean, if we can collect the data for the last 10 years, it would be a huge input for the registry. We can do multiple studies on that actually, and hopefully we can cooperate in better way.
Inshallah, hopefully. Thank you, Alwarth. Thank you.
You're most welcome.
Any other questions, suggestions? So I think we'll stop here. Thank you all for being here, and wish you a happy afternoon for those who are in the afternoon period.
Thank
See you all.
you.
Thank you.